The Knowledgeable Provider podcast is educational, entertaining, and not the same as medical training. The information presented here should not be used by anyone to diagnose or treat any medical condition in themselves or others. If you need medical advice, go see your own knowledgeable medical provider. Opinions expressed on the podcast are solely those of the people expressing them and are not necessarily representative of any other entities. Other than lunches at the office, I do not receive any sort of compensation from pharmaceutical or medical device companies, and I have no other relevant financial disclosures. It's all fun and games until someone gets sued, am I right? Okay, on with the show. Hello, welcome back to Knowledgeable Provider. I'm your host, Jody Marks. We've made it to the letter J in our Alphabet Soup series of topics, and this is kind of the first time I've really had trouble deciding what to do the episode on. There aren't really many things that start with J to talk about. You got jaundice, of course, which generally means that something is wrong in your liver area, the hepatic region of the body. There's not really much more to say about it than that. And you have things that have juvenile in the title, and you have a bunch of very rare syndromes that are named after like the two people who have ever had them. So not a whole lot that's relevant to my kind of clinical practice. But then serendipitously this week, one of my patients came in having been put on a new medication that I'd never heard of before that happened to start with a J. So that's what I'm covering today. First in the news, sadly, there was a medical helicopter crash yesterday. That would be Saturday, November 8th. Vanderbilt Life Flight 1 went down in an unpopulated area in Wilson County, Tennessee. That helicopter is based at the Sumner County Emergency Operations Center in Gallatin, Tennessee. No patient on board. One crew member killed. That was flight paramedic Andrew Sykes. The other medical crew member was Alan Williams, who is a flight nurse and also a paramedic. He and the pilot, whose identity is not being released, are currently in critical condition, being treated at Vanderbilt. So, of course, our thoughts are with their family members and coworkers. Such a tragic thing to have to deal with. Of course, they haven't said anything about the cause of the crash yet. It always takes the NTSB a long time to figure that out. Kind of hoping it's not pilot error. I'm not an expert on medical helicopter crashes, but I do tend to read about them when those reports come out, and it seems like a lot of times that's what it comes down to is pilot error. So again, I don't know anything about the cause of this particular crash, so we'll keep our fingers crossed that the two remaining crew members survive and that there's some reasonable explanation for why it happened. The government shutdown continues. As far as I can tell, there's been no real progress in fixing it. We're starting to hear a lot more about air traffic delays, and I have a flight scheduled in a few weeks, so I may end up being impacted by that as well, considering going ahead and reserving a rental car just in case. The big medical news this week would be the Trump administration's negotiation with Eli Lilly and Novo Nordisk to cut the prices of GLP-1 medications, which is a big deal. Let's give credit where credit is due. We know there are a lot of people who have benefited from those medications and a lot of people who still could benefit from those medications, but a lot of those people still cannot afford them because they're not covered by insurance and they're still pretty expensive. You can buy semaglutide and tirzepatide directly from the manufacturers, still going to be in the $300 to $400 to $500 a month range depending on the dose. Somehow weight loss clinics are still doing their thing. I don't quite understand where that medicine is coming from since I didn't think they could compound the medications anymore. But from what my patients have told me, those weight loss clinics tend to cost about the same amount of money as buying it directly from the manufacturer. And then you have the people who are ordering the research peptide version that you're not supposed to put in your body and putting it in their body anyway. I'm not a proponent of doing that. Don't recommend anyone do that. So it would be very helpful if more people could afford the real versions of those medications. The agreement that the administration has reached with the pharmaceutical companies will cut prices of these medications for Medicare and Medicaid beneficiaries starting next year, and also the cash price of the medication, which you will be able to buy from a website, which will be launched in January called trumprx.gov. It looks like the prices are not super lower than what you can already buy them for. According to the article I'm reading on CNBC, the tirzepatide and semaglutide will be about $350 a month from TrumpRx and will go down to $245 a month over the next couple of years. That's getting down into a neighborhood where I might consider paying cash for these medications. I would certainly benefit from taking one of these, but it's just not quite cheap enough for me to bite the bullet yet. My personal insurance will cover it for diabetes as long as you've tried literally every other class of diabetes medication first. And I don't have diabetes. I would just be using it for weight loss. So I'm out of luck on that avenue. It looks like maybe a $50 copay for quote unquote certain Medicare patients. That's $50 a month. They're making this available to Medicaid programs in all 50 states, but the states will have to opt into those prices somehow. So maybe not every state's going to do that. It looks like the new coverage of this is going to go through a pilot program that should cover most beneficiaries under Medicare Part D. And I don't really know enough about prescription drug plans and Medicare to say any more than that with any certainty. They did discuss prices of the oral versions of these medications that are coming out soon. Those are going to cost about $150 a month, whether you get it through Medicare, Medicaid, or Trump RX. Oh, I hope I don't have to say the name of that too much more. So there's some positive news for the week. On to our topic. The medication that I became aware of this week because a patient came in on it was prescribed to them by a neurosurgeon. It's called Journavx, Journavx. The generic name is suzetrigine. This is considered a new class of non-opioid pain medication. It was approved at the end of January of this year. It received designations of breakthrough therapy, fast track, and priority review by the FDA during the approval process. Its mechanism of action is blocking a particular sodium channel. This is a voltage-gated sodium channel called NAV 1.8, which is expressed in peripheral neurons but not in the central nervous system. And my first question about this was, how does it differ from anticonvulsants, right? Of course, the name makes you think of lamotrigine, which also works on sodium channels, but different sodium channels. Lamotrigine does work on voltage-sensitive sodium channels, but obviously, as an anticonvulsant, it works on ones that are present in the central nervous system. And lamotrigine affects multiple different types of sodium channels, not just specifically one type like the new medication does. So that would be the difference. They evaluated the efficacy of the medication in 2 randomized double-blind placebo and active controlled trials of acute surgical pain, one following abdominoplasty and the other following bunionectomy. Participants in the trials were allowed to use ibuprofen as needed for rescue medication, along with their Journavx or placebo. And both trials demonstrated a statistically significant superior reduction in pain with the Journavx compared to placebo. Total of 874 participants in those trials. In addition, they got safety information on the medication from a single-arm open-label study involving 256 participants with moderate to severe acute pain in a, quote, range of acute pain conditions, unquote. Most common side effects: itching, muscle spasms, increased CPK level, and rash. You should not use it along with strong inhibitors of CYP3A, and thus people should not drink grapefruit juice when they are taking Journavx. Medication is manufactured by Vertex Pharmaceuticals Incorporated. This is not an ad. This is not sponsored, but it could be. Vertex Pharmaceuticals. Please send me some money. I'd be fine with that. In my N of 1 clinical experience with this medication, the patient who is now on it seems very happy with it. They told me that it controls their pain, and they have not so far experienced any significant adverse effects. I actually mentioned last week about the article I saw about gabapentin prescriptions becoming a lot more common, so maybe this will be a nice alternative. You would think it would at least be somewhat helpful for neuropathic pain, just based on the mechanism. And I don't see any reason why you could not give it along with a gabapentinoid, if that was your situation. It looks like there's a loading dose of 100 milligrams, and then after that, it's 50 milligrams every 12 hours. They only have safety and efficacy data out to 14 days. You don't have to adjust the dose for renal impairment, liver issues. You want to do half the dose if they're child Pu B, and not recommended for use if they're child Pu C. Doesn't seem to cause any QTE prolongation. Evidently, it has been compared to hydrocodone and acetaminophen at some point, and it does appear less potent than that for reducing severe postoperative pain. The actual approved indication is moderate to severe acute pain in adults, so pretty broad use there. But it is not approved specifically for neuropathic pain or chronic pain or any specific pain syndrome. So, all right, there you go. That's some kind of exciting news. Maybe a new tool in the toolbox. Obviously, it's very new and was approved relatively quickly, so we'll see how it goes. But that may be a good option for pain control in the right situation. Of course, I haven't met any of their reps, so I don't know if they have a discount card program or any of that business, but I'm sure they do. If you have any experience with it, or if you know anything about it that I didn't cover, please get in touch. I so appreciate everyone listening. Extra special thanks to our Patreon supporters who send me a little bit of money. which is very motivating for me to keep doing this. I hope that everyone has a wonderful week. Take care, and I'll talk to you later. All right, that does it for this episode of Knowledgeable Provider. Very special thank you to our Patreon supporters. If you would like to help support the show for just $5 a month, please head over to patreon.com/knowledgeableprovider. If you're looking for more content, check out our YouTube channel and our Facebook page. Remember, all of those ratings, reviews, likes, follows, subscriptions, etc. really do help the show, so take a second and do those things to help me out. If you have a request for an episode topic or if you'd like to be a guest on the show, I'd love to hear from you. Email me anytime at thekppod@gmail.com. That's thekppod@gmail.com. Thanks so much for listening, and as always, stay safe, take care of yourself, and take care of your patients, in that order.